All right, let's jump right in. We're going to talk about a huge shift, a complete reimagining of what it means to be a nurse leader today. It's no longer just about the bedside, it's about leading from the boardroom, because frankly, our healthcare system demands it. But to really get why this new kind of leader is so important, we have to first look at the system they're working in. And, it's under an incredible amount of pressure. This isn't about small problems. We're talking about a full-blown crisis. Just look at this number for a second. It's almost hard to believe. Up to 400,000 people every single year dying from unsafe medical care in the US. I mean, to put that into perspective, that's the third leading cause of death. Think about that. Right up there with heart disease and cancer, this isn't just some number on a slide. It's a massive wake-up call that things have to change, and fast. And, it's not just one thing. It's like this perfect storm of challenges all hitting at the same time. You've got shifting demographics, an older population with more complex needs. You've got technology that's just exploding, sometimes faster than we can keep up. Patients, rightly so, are more aware and are demanding better, higher value care. And then on top of all that, you throw in major workforce shortages and totally new ways of getting paid. What you end up with is a system that's just in constant, nonstop flux. So, with this crisis brewing, the Institute of Medicine released this huge, game-changing report. It was basically a national call to arms, and it completely changed the game for nursing, really pushing the whole profession into a brand new era of leadership and responsibility. And this quote right here, this is the turning point. This is the moment where leadership went from being this, optional sidetrack for some nurses to a core expectation for every nurse. The message was loud and clear. The people who are right there with the patient, they have to be the ones shaping the future of healthcare. And the report didn't just talk in big ideas. Nope, it gave a really clear 4-part blueprint for action. First, let nurses practice to the full extent of their education. Second, encourage them to get even more education. Third, make them full partners, equal partners in redesigning how we deliver care. And fourth, let's get better data to actually plan for the workforce we're going to need. Okay, so then you have professional groups like the A&E, who took that big vision and boiled it down into these 5 core skills for the modern nurse leader. And what's so striking is how much this goes beyond the clinical stuff. We're talking about real business skills, understanding the entire healthcare landscape, top-notch communication. I mean, think about it. That business skill, that's what a nurse leader uses to make the case for the staff and the equipment that will prevent those 400,000 deaths. This is the new playbook. All right, so that's the what, the skills you need. But the bigger question is the how. What's going on inside a leader that allows them to master all of this? What's their, internal operating system that lets them handle all this complexity? And the answer really starts right here, emotional intelligence. And please don't think of this as some soft skill. It's not. It's foundational. It's the raw ability to read the room, to understand what you're feeling, what your team is feeling, and then use that information to make better decisions. In a pressure cooker like healthcare, this is absolutely essential. And look at the real-world impact of this. When you have leaders with high emotional intelligence, they can actually tackle those huge workforce problems we talked about. They're better at preventing burnout and compassion fatigue. They're better at keeping their people. They create work environments that are actually healthy, where people trust each other and feel like they can do their best work. It's a direct antidote to the stuff that pushes so many great nurses out the door. So, how do you build up that EI muscle? Well, one of the most powerful ways is through mindfulness. And let's be clear, this isn't some mystical thing about having a totally empty mind. It's way more practical. It's about training yourself to pay attention, on purpose, to what's happening right now without immediately judging it. It gives you that little bit of space so you can see things clearly instead of just reacting on autopilot. And what do you get from that practice? Resilience, the ability to bounce back. Because let's face it, in healthcare, stress and setbacks are not the exception, they're the rule. Resilience is what allows a leader to not just get through a tough day, but to actually learn from it, adapt, and come back stronger. It's like psychological armor for the modern leader. Okay, so we've talked about the internal mindset. Now let's shift gears and look at the leader's toolkit. How does all that inner work, that emotional intelligence and resilience, actually show up in the real world? What do these leaders do? The first tool isn't really a tool at all. It's more like a lens. It's called systems thinking. And it's all about training yourself to see the big picture, the whole interconnected system, not just your own little corner of it. A leader who thinks this way knows that if you pull a thread over here, the whole fabric is going to shift. And here's a great real-world example of systems thinking in action, a program called Team Steps. It's a proven, evidence-based system that's all about improving how teams communicate and work together to make patients safer. This isn't just fluffy theory either. It gives teams actual tools, like specific scripts for patient handoffs or ways to double-check information so nothing falls through the cracks. It's a step-by-step process to build a better, safer team and make sure those improvements stick around.
But even with all the best systems and protocols in the world, maybe the most powerful tool a leader has is the one that's focused on people. And that tool is coaching. Not just any coaching, but developmental coaching, which is all about helping people unlock the potential they already have inside them.
Now, we have to be super clear on this point. Coaching is not the same thing as performance management, not at all. Performance management is about looking in the rearview mirror, fixing past problems, making sure people follow the rules. Developmental coaching, that's all about looking forward, through the windshield. It's about building people up for the future, helping them grow and learn, not just checking a box. Okay, that all sounds great, right? But does it actually work? What's the real bottom line payoff when an organization invests in this kind of leadership? Is there a tangible return on that investment? Well, the data is, honestly, it's pretty staggering. Get this. Studies show a return on investment of around 700% for companies that invest in coaching. That's not a typo. 700%. This isn't some feel-good initiative. It has a massive, measurable impact on the bottom line.
And check this out. That huge number includes the money saved by keeping good employees from leaving. But even if you take that part out, you're still looking at an ROI over 500%. That just goes to show you that coaching makes people better at their jobs, plain and simple. It boosts performance and efficiency everywhere.
But really, the biggest payoff isn't just about the money. An investment like this can change the entire DNA of an organization. It helps turn it into what we call a learning organization, a place that's not afraid of change, but is actually built to adapt to it, to innovate, and to thrive, no matter what gets thrown at it. And this isn't just something for the C-suite. Coaching works at every level. For someone just starting out, an emerging leader, it gives them confidence and helps them make an impact early on. For a brand new manager, it's a lifeline that helps them bridge that gap from doing the work to leading the work. And yeah, even for seasoned executives, it sharpens their strategic edge and helps them navigate all that complexity at the top. When you boil it all down, it comes back to a really simple, powerful truth. The work of the organization, it lives or dies by the effectiveness of its leaders. It's that simple. An organization can't be any stronger than its leadership. So, all of this leaves us with one big, lingering question. As healthcare gets more and more complex, how do we make sure every single nurse is empowered to do more than just care? How do we empower them to truly lead? Because the future of our health might just depend on it.